What I'm going to be talking about today is some new information that you may have not heard about before about a treatment option that I've been using for about 25 years to reduce and resolve fermentation issues in my patients. And I want to explore that with you as an option to either herbal or prescription antibiotics. The study that we're going to look at today is not a rare finding in my practice. It's not an isolated case. It's something that I actually see a lot of, and the majority of my patients that are coming to me have failed Rifaxamin and have had several prior SIBO tests. So I see this kind of situation almost every day. I've seen many patients statewide, nationwide, globally. This particular one we're going to talk about is in Washington State. And just a disclaimer, that I do have a book and a supplement line based on the treatment that we're going to talk about. Okay, so let's dive in. This is a 57-year-old female. She has comorbidities of a history of breast cancer that's in remission and melanomas. She has a family history where her father died of prostate cancer and her mother of cardiovascular disease. She's married, she's retired, she doesn't use tobacco or alcohol, and she has 1 serving of caffeine a day. Her current prescriptions are Zyrtec for allergies and meloxicam as needed for pain. She does have a childhood history of constipation. Her symptom onset was in 2018, and she started out having symptoms of constipation alternating with diarrhea, bloating, and gas pain. So let's stop there and just break this down. And I do this with every patient. It's like, what are the causes of these things? So you don't jump into anything too rapidly. So alternating constipation diarrhea is motility and peristalsis that can be caused by using laxatives, where you are cleansing out the system and then you're backed up for a few days. It could also be caused by a food intolerance easily. So if there's a food you don't know that you're eating that's inflammatory and you eat it sometimes and you get diarrhea and then you stop eating it and you're backed up. So food intolerance is really important to roll that out. Bloating and gas pain can also be caused by food intolerance with, again, the big classic players, eggs, wheat, dairy, sugar. It can also be caused by SIBO, SIFO, dysbiosis, and even a constipation etiology of lower abdominal bloating when someone's really backed up and they might not even know they are, because they might actually even be having diarrhea, but it's moving around and they're actually backed up and they're feeling bloated in the lower ab because that needs to be eradicated. So once food is ruled out as a cause of this, then I want to be looking at fermentation so we can figure out, okay, bloating and gas pain not caused by food, so it's caused by a microbe. What is fermenting? Is it a yeast? Is it a bacteria? Is it both? What is it? With this particular patient in 2018, with the onset of her symptoms, she went to many different doctors. She tried herbal antimicrobials like oregano and allicin and berberine and other compilation formulas. She tried motility agents, herbal and prescription loperamide. She tried biofilm agents, both herbal and compounded. Nothing really changed. In 2017, she'd had some imaging studies done and a colonoscopy. In 2017, everything was normal, so that was a year before the onset. In 2019, a year after the onset, she had an abdominal ultrasound and CT scan. Both were normal. She'd had a gastric emptying scan. That was normal. And in 2020, when she was in the midst of her discovery, she had an IgG food panel, and that was pretty much normal as well. Nothing really peaked on that. So in 2019, she saw her first SIBO specialist. She went in, they did a SIBO breath test, and she was positive for hydrogen and methane gas production. And I want to jump in there and say, hydrogen and methane gas production are non-specific. Right? We know that she was producing these gases. What we want to know is, what does that mean? And that's important, especially considering 30 to 50% of the normal healthy population produces methane gas. So not to jump the gun on that one. So she got this positive test back, and they started with a dose of rifaxamin and neomycin, 14 days. And what she did notice was that she was somewhat improved overall. Not entirely gone, but she did feel less bloating, less gas, less pain. And that lasted for about 2 months. And then, boom, it all came back with a vengeance. And this is not an unusual finding. All of you all who treat this and use this antibiotic, I'm sure you've seen this before, gets better and then it comes back. And that's not really unexpected, since the documented relapse rate with Rifaxamin is 45%. So almost half your patients that you treat with this medication, you're going to see them again because they're going to relapse. We also know that the efficacy of Rifaxamin in SIBO treatment and diagnosis is 61 to 78%. And that's from Yale Medicine. So she goes back to the doctor, and they retest the SIBO test. And this time, she's still methane and hydrogen positive. So they figure, okay, well, let's just repeat that course, because it seemed like we had some impact the first time. So she's given rifaximin and neomycin for 14 days. This time she improved a little bit less, and for a shorter duration, about 6 weeks or less this time. So here's what I'm wondering. Why didn't it work as well? Did the organisms that you're targeting develop a bacterial resistance? I don't think after 14 days with a 2-month reprieve, that's highly likely. But her symptoms returned, and they were just as bad as pre-treatment levels after the little bit of improvement. So if the cause is really the targeted bacterial species, we can reason that the second course of Rifaxamin would result in an improved, or at least equivalent results. So are we on the right track here? She goes back a third time. She has a third SIBO test. She's still positive for methane and hydrogen gas production. So this time what they do is decide, okay, well, let's do rifaximin with metronidazole instead of neomycin and see what we get. This time she improved, again, a little bit of improvement, only lasted for 4 weeks. All the symptoms came back. She went back to the doctor. This time they just didn't retest. They're just like, let's just assume this is what's still going on, and we'll use erythromycin this time. So we'll use rifaximin plus erythromycin. Again, she had a little bit of improvement for about 4 weeks, and then all the symptoms came back. So when I stepped into the picture, she was waiting for a shipment of her 5th course of rifaximin. So let's just take a break here and talk about this treatment and just get some discovery. So the principles that I'm considering are, is SIBO really the cause, or is it the result? Is the SIBO test accurate? Dr. Josh Goldenberg does a really great analysis of the SIBO test and does not get it a very high rating in terms of accuracy. And you can find that on his YouTube channel. He's a smart guy. We do know that 30 to 50% of the healthy adult population worldwide produces methane, which is detected in a breath test. So what is it really telling us when you get a methane positive sample? Is it really giving you good data? And then we'll continue on in the second part of this series.